Hi, my name is Dr. Scott St. Amour here with RBK Pediatrics and Urgent Care, and I'm just making this video in preparation for your 5.5-month-old visit here at RBK Pediatrics. I just want to talk a little bit about what to expect, some of the things that we talk about, and answer some of the common questions that we tend to get at this age. So, welcome back. Just to remind you about us, we're always around. Anytime you need anything, all you have to do is call us. We have doctors on call 24/7, so even in the middle of the night, if you have any questions or concerns or anything, you call the office, the doctors get a message, and we call you back in about 20 minutes. We have telemedicine appointments available, we have urgent care hours, and we fully admit our patients over to Good Sam and take full care of them. So we're here for anything that you need. All you have to do is give us a call. So, what to expect for your 5.5-month-old visit? Well, the first thing that we're going to do is review everything that's gone on since the last time we saw you. Any updates to your medical care, any other doctors that you've seen, urgent care visits, ER visits, any updates that we need. The most important thing that we always do with these visits is check that weight. You will never leave our office without looking at those growth curves. It is by far the most important thing that we worry about with the kiddos at this age. So we'll do the weight check. And always a good, solid, full physical exam. Always gentle and nothing unnecessary. We always follow the American Academy of Pediatrics guidelines for everything that we do. And of course, we'll answer any and all questions that you have. Don't feel rushed in your appointment. The whole purpose of being here is to get all of your questions answered and making sure your kids are growing, healthy, and happy. So 5.5 months old, one of the most important things that we can start talking about at this age is the sleeping. At this age, the kiddos are finally old enough that they're able to learn from their own experiences, which means we can actually teach them stuff, simple stuff, like what to expect of things. One of the most important things that we can teach them nice and early is what we call self-soothing. Effectively, we teach them how to sleep in the dark by themselves at night without waking up all of the time. Effectively, what we're teaching them how to do is to stop and use their own experiences before letting the emotions bubble up and take control. At this age, they're waking up and crying because they're scared of the dark. They're not hungry like they were when they were newborns. Unfortunately, we can't tell the kiddos that they're safe in the dark by themselves. They have to experience it themselves to actually learn it. So the only way they learn it is to be in the dark by themselves. So, take the little crib and move it to a different room, one where they can't just look over and see mommy and daddy sitting there. Get a good bedtime routine together. Do the same things in the same order at the same times every single day. They're learning from their own experiences, so they'll start recognizing the bedtime routine and start conking out for you in the middle of it, which will help you out a bit. So now, after you get them down, you give them the little kiss, you turn out the light, and you leave the room. They're going to start crying because they're going to get scared. But you need them getting used to the dark and teaching themselves that they're really safe. So now you just ignore it. You give it 15 minutes. If they're still crying after 15 minutes, that's when you go into the room, you pick them up, you give them hugs and kisses, you tell them how safe they are, you tell them what a big boy and girl they are. You get them nice and calm, but no wasted time. As soon as they're nice and calm, they get their little kiss, they go right back down in that little crib, you turn out the light, and you leave the room. We don't want to teach them that you're going to help them fall asleep now. And so you just repeat that process all night long. Every time they start to cry, you ignore it for 15 minutes. Then you go in, hugs and kisses, no wasted time, right back down in that crib, turn out the light and leave the room. You repeat that all night long. This is the earliest that they could possibly learn this, which means it's the fastest they can learn it because we have no bad habits here to break. So just stay nice and strong. And as soon as they learn they're safe in the dark by themselves, you get 18 years of full nights of sleep. The other thing that we talk about this age is the feeding. At this age, we can start with the solid foods in the kiddos. But remember, the solids at this age are not for any sort of actual nutrition. It's for the practice, the bonding, the fun. But the breast milk and formula is still by far the best source of hydration as well as nutrition for the kiddos. So we still want pretty much all of their calories coming from that. So just a couple spoonfuls at a time, just a couple times a day. I recommend starting with the dark green leafy vegetables and the bland proteins. Tons of iron, good soluble fiber in those vegetables. I recommend avoiding the sweet fruits because we don't need them for any sort of actual nutrition. The kids get a taste for that sweet. and then they don't want anything else and they become picky at an early age. So I say just hold off on those sweets for right now. And remember, we still advise the kids nothing to drink except for the breast milk and the formula. No water, no cow's milk, and no juice. As always, since we're giving them more food and more to eat, they're going to have more poop. So just maintain care of that diaper area. Keep putting the barrier creams on there and keep slathering that moisturizer on there. So we're looking forward to seeing you for your 5.5-month-old visit. Remember, we're always around. Call us for anything you need at RBK Pediatrics. Primary care when you want it, urgent care when you need it. I'm Dr. Scott St. Amour, and we'll see you when you come in.